Hello, everybody. Thank you very much for being here and attending this session. This session is entitled From Science to Policy, How to Inform Decision-Making on Pandemic Prevention, Preparedness and Response. It's been co-organized by the PREZODE initiative, which I have the pleasure to represent here. And also, of course, by the Paris Peace Forum. We are very grateful for all the help and attention to this subject. So on this panel, I will have the pleasure to welcome and give the floor to Peter Sand, here, Peter Sands, Executive Director of the Global Fund. Anne-Claire Ramprou, which will come later, and she's Ambassador for Global Health for France. Papa Serigné-Sec, Technical Advisor in charge of Animal Health, Livestock and Fishery, Presidency of the Republic of Senegal. Priya Bashu, who is here. She is the Executive Head of the Secretariat of the Pandemic Fund, based in Washington. Eloise Todd, and she's the Executive Director and co-founder of Pandemic Action Network, so representative of civil society. Agnès Souka, Head of the Health Division, Agence Française de Développement. Osman Dar, who is the One Health Project Director and he's from the Royal Institute of International Affairs, Chatham House, and is the member of OLEP, the One Health High-Level Expert Panel. We also have the pleasure to have Marie-Ange Sarakayao, and she is the Chief Mobilization and Growth Officer from Gavi. And we have Barbara Stocking. She is the chair of the panel for a Global Public Health Convention. So thank you all for coming here. Some are coming from quite far away, so thank you for this. So I'm Elisabeth Cavry de Saint-Martin. I'm the CEO of CIRAD, which is a center of research based in more than 60 countries, and I'm here because CIRAD is co-leading the PREZODE initiative, which is an initiative on One Health. This roundtable is a unique occasion just to have an exchange of view on where we stand nearly 3 years after COVID. Did we make the progress we wanted to make? Have we achieved all we wanted to achieve? And has the science policy interface has grown more fruitful as it was just before the COVID? So in a way, this is a meeting point for further efforts and endeavors, I know, which are taking place both in Geneva and other multilateral platforms. So perhaps I will start with a question, and I hope we could interact in a very free way. The first question would be, how can science inform decision-making on pandemic preparedness and response? And I will perhaps ask Osman Hadar to give us his view on it.
Okay. Firstly, Elizabeth, thank you so much for the kind invitation. It's really wonderful to be here. I think I should mention that OLEP itself was, we owe the Paris Peace Forum our existence, because the idea for OLEP came about at the 2021 Paris Peace Forum. So we are OLEP because of the Paris Peace Forum. So thank you for that. And just to say also that, I come across CIRAD colleagues, the technical staff, quite often when we were doing projects in Africa, and they're always amazing and lots of fun to work with. So again, you're leading a wonderful organization. On your question, how does science contribute to the policy and informed decision-making? Well, obviously, science is critical to it. But the question is, what science and how we structure that, and what we value and acknowledge as science, and how the different voices and different bits of science get included in a sort of cohesive, coherent way, and that's where the challenge lies. You can divide it sort of broadly into natural sciences, So that's the pathogen life cycle, but also the human host animal interaction. There's the epidemiology of it, of course, but we like to think of it particularly from a One Health perspective as something a little bit broader. The entire life cycle of the pathogen or the hazard, as it relates to its movement through the ecosystems and the environment, through the animal world, and through humans as well. And so that means that you have to include, especially those bits that are crucial to prevention, the prevention of spillover from the environment, ecosystems, and animals into humans. So what are the drivers around those? That is all part of the science of this. And that's the bit that we often forget about, that's underinvested in, and we really need to be putting much more of a focus. Alongside that is so we've talked a little bit about the natural sciences, but then there's the social sciences as well. How that applies to prevention, how that applies to preparedness, how that applies to response. And particularly, I mean, the most telling examples of that are obviously as part of the response. What were the behavioral risk factors across societies when we had the COVID-19 pandemic? What was the trust between governments and societies? How did that evolve over the course of the pandemic? All of these are issues that require really a strong grounding in social sciences and research to address. And the question becomes, how do you coherently integrate that into a preparedness and response mechanism? And that's where a lot of countries have had challenges, and where we need to find sort of better solutions around some of these issues. I'll pause there, but then we can circle back to some of this.
Thank you very much for your words. That's very useful to set the scene. We should have had with us Miso Munyeme, but due to travel constraints, he was not able to make it. So I would try to replace it in a very humble way. Just giving you 2 words about PREZODE, which he hoped to have presented. Just to recall that PREZODE is a science-led coalition that supports bridging all steps. First, from making recommendation based on scientific evidence, for instance, in terms of risk prioritization, which is very important when you deal with constraints, with resources which are very constraints, to identification to risk practices. In PREZODE, we have tried to develop a step-by-step approach on how to develop a One Health community, because we strongly believe that it has to be based in the community in a way to empower the people, that they can be the actors of health risk prevention. And also we believe that implementation in field with technical assistance is really key to the success of the project. And finally, and this has been very well underlined just by Osmar, we believe that evaluation and accountability is key so that the project can really be embedded in the more global policy. So for PREZODE, I would stop here, and of course I remain at your disposal for any question you might have on this initiative. Perhaps I will go to a second question so that we have more time for discussion. And I will ask Papa Serenier-Sec and Barbara Stocking to answer this question. What are the key actions you see and you think are needed to integrate scientific initiative into national and regional prevention strategies? You can speak in any language you wish, and I will switch to French at one moment, so feel free.
I will do like you, if you allow me. So thank you so much, Madam Chair. I'm very pleased to be here this morning, and I would like to thank the organizer, the Paris Peace Forum, and PREZODE for inviting me in this very important roundtable. So now to get to the point, if you allow me, by responding to the question, I would like to recall that the COVID-19 crisis really demonstrates that it is a systemic and a polymorphic crisis, which required also a very polymorphic response, leaving no one behind. And based to that, we recognize that preparedness is very key. Preparedness is global goods that really requires global capacities that all communities should have to implement, firstly on local level, but also on national, regional, and global level. And by doing so, we need really key actors, key stakeholders, like the government, the public sectors, the private sectors, but also the scientists. We should be the backbone of any strategy, scientific strategy we should implement and undertake during a global health crisis. And those scientists should not work in silo. They should work with all communities and allow themselves to attain the political platform, but also those platforms we share with the private sectors, the public sectors, the communities themselves, but also the high-level decision makers. And that's really what I think, from my view, to be able to really implement good preparedness strategy and response and beyond resilience strategy. The example I would like really to mention here is the situation of southern countries. When COVID-19 hit the world, many of you were thinking that it will devastate the southern countries. But luckily, we saw that there was some southern countries, even low-income countries, really we show good resilience face to that crisis. How come? Because somehow there was a little bit prepared. As you know, like CEO of SURAD, you know that there is a long-term, historical collaboration between SURAD and Senegal, Institut Pasteur, the LENERV, Israel, etc. And we run together a lot of projects and programs in the past to face some disease which burden the animal sectors, and in the health sectors also, we run a lot of disease by vaccination, for example, the polio vaccination, yellow fever, etc., etc. That really made us a little bit comfortable dealing with the COVID-19 crisis and dealing with vaccination. I guess recall the example of Senegal. The time we used to set up vaccination program and the vaccination itself in Senegal was really very unexpected, really. Within some months, we were capable to buy vaccine and also start vaccinating the population, and even share vaccine with neighboring countries like Gambia and Guinea-Bissau. And among those programs, we should really learn us to prepare ourselves. I can quote the REDICE program, which is a regional program funded by World Bank for surveillance for any transboundary disease and zoonotic disease also. We share with 11 countries in Africa and in southern countries. And the RESILIENCE program really was a good example for us to gather all stakeholders, all sectors and partners surrounded a program, surveillance program for health threat. And after we set up the RESILIENCE program, 2 years after that, the COVID-19 hit the world. And really, we really took stock from what we really implement with the RESILIENCE program. So does allow me to say that in regional level, really we need to harness our capacities, but also to harness our knowledges. I mean, those scientific in the regional level should be in regional working group or regional network, and to be able to really play their role in different strategies and program we have to deal in regard of health threat. And I would like to end here by telling that the regional economic communities should really buy in, but the political and financial support really we need to run those transboundary program. We need really to have this financial and political support we need should really come from the regional economic communities. And I think that for an issue of sustainability, it is also to be highlighted. And I would like to end here my point, and I'm open to other questions. Thank you so much for listening.
No, thank you very much, and thank you for enlightening the experience of Senegal and showing how, in a way, the previous policies and all the cooperation, which have been either bilateral, either funded by World Bank and other institutions, have helped you to respond and to have some structure, some global view, which gave you the architecture of One Health, and you've been able to face and to be quite resilient, and at the same time to work on a regional level, which is very important from a scientific point of view, because unfortunately pathogens don't respect borders. They're very, they're not so easy. Perhaps I would ask Barbara to give us a highlight from her point of view, which is more global, but at the same time you see all the challenges and how we can make it so that this scientific initiative can also reach in poorer countries, in vulnerable countries, the point so that they can also influence the policies there. So thank you, Barbara. I'll give you the floor.
Great, thank you very much, and it's a great pleasure to have been invited here today. And I'm very glad you just sort of finished with this question of the political, because that's the bit I wanted to really come to. We all know that at the beginning of COVID, many of us, most of us probably, had governments that had, and heads of state particularly, or people across other walks of life rather than ministers of health, but other ministers, had very little scientific knowledge about pathogens, and why would they? And I think that, you could see people really trying to catch on and find out what was going on, but very difficult indeed at the time when you've got to make a lot of very difficult decisions. And I think the first thing I wanted to say is that the one thing that we need to do in preparedness is to make sure our governments are actually prepared, in the sense of knowing a lot more about what you do when you have outbreaks, and the way that they can actually move to pandemics. Because and it's very important, of course, that the scientists have access to them to really do that, but in the state of preparedness, not just at the beginning. And one of the key issues, I really believe very strongly, is a real problem, is that they don't understand the exponential spread of disease from outbreaks to pandemic, and just how quickly it can happen. It is literally days and hours, to get massive takeoff. And I think that most people in those senior positions wouldn't have known that in advance, really, or understood the implications of that. Now, that itself is very difficult, because you can say, well, we really want to sort of make sure everybody understands the precautionary principle, i.e. you do something before it happens. That actually is very difficult for governments, because, of course, with your public, you often can't prove that if you did something, that it actually stopped you having a pandemic. But you know when you didn't do it, and you get one. So that's the real problem. And I think to some extent that's not so bad when it comes to things like, having stocks of PPE and so on. You can think about having been really prepared and doing that, and in a precautionary way. It's a much more difficult question if you start saying to your public, you can't have major meetings, you can't have more than 20 people at events, and all those sorts of things, when they haven't yet themselves seen what's going to happen and can't necessarily understand it. But that's a real key issue in that, as I say, that's in the funny story of the anaesthetist who doesn't get any sort of satisfaction when he's done a good job, but certainly does, when he hasn't, sort of thing, or she. Now, so the first thing is to get a lot of people in senior places in government to understand a bit more. Now, how do we do that? Well, one of the ways, of course, is by things like exercises and simulation processes. And I really do think that's good to help people put through. Not that we all know that those aren't real scenarios, they are partial, they are possible scenarios, but they at least give you the chance to practice making decisions, to practice thinking, really, in that case, how you do put together the science with the other issues that you've got to deal with, including, of course, what your population will actually take. If you say you've all got to wear masks because the evidence is there, will your country do it? Is it used to doing that? If you start, talking about lockdowns, schools opening, the great differences that we have just from actually my own country, UK and France, in how schools were handled. All those sorts of things. They are very difficult decisions for people in governments to make. And so just actually having the time to practice, I think, is very important. And of course, making sure that the science is brought into that as well. It's not the policymakers just going off on their own. It's using the science in at those times and in those ways. So that would be the case I'd like to put in for really, as I say, getting our leaders to be at least adequately knowledgeable about the science, so that we can get on. And of course, they will learn more, as they're going through any of these processes. So thank you for letting me say that.
Thank you very much. That's very interesting. And what is interesting also is that you point at the question of preparedness is both the preparedness of our decision makers, which have not this scientific culture most of the time, and do not have neither the scientific committees. Now they do, but before the COVID, mostly they didn't have, and also the preparedness of the population and of the civil society. And perhaps I will ask Eloise Todd to jump in and from the civil society point of view on this, if she has some comments.
Thank you so much, and it's a great privilege to be with you today. I was thinking about the main premise for this session and about the importance of following the science. And actually, in order to do that, and it relates to what Dame Barbara just said about preparing government officials and politicians, we need to advocate the science and we need to communicate the science. And I think sometimes in our world, Pandemic Action Network, where I'm the executive director, we try to bring together these cross-disciplinary groups and organizations, mainly civil society, but not only. We also work with partners across the piece because we believe that in order to prevent future pandemics, we have to get every element of society on board. It's often bundled into a health issue because, of course, a pathogen causes disease. But we absolutely have to see this as a cross-disciplinary issue. And I would say that in our discussions, we're often very good at coming up with the solutions we need, the policy formulations. But that's not the only way that we get there. It's about how do we win the hearts and minds to put those in place? How do we get campaigning potential behind that when in these times of scarcity and the world is in a parlous state, as we know, it's harder and harder to get resources for what we want. So we have to really think a lot more creatively about making the broader case for science, the broader case for advocating and communicating these things in order to get the resources we need for all of this. And back to the One Health of it, just thinking about the pandemic accord process earlier this week, a few little insights or pointers or thoughts from us at Pandemic Action Network from what we noticed in the room. One Health came up a little bit, but not so much. It was mainly from high-income countries, and we really think we have to learn the lessons from climate change and make sure this does not become a north-south divide issue. It's all well and good for us to have our very high standards and to want to raise all of that and have that kind of level. But if that's seen as another barrier for low and middle income countries, the politics are going to be wrong from the outset. So that makes the case for more investment, but it also means that where this comes from and how we engage is really, really important. And I would commend PREZODE as a brilliant initiative with global institutions and researchers, and that's exactly the kind of approach we need. But we have to make sure that communities are involved, civil society is involved, and that we don't allow One Health to become a divisive issue. So just a few different thoughts from a civil society perspective, and it's a great honour to be here today. Thank you.
Thank you. Thank you very much, Eloise. And I think we can all support the idea that One Health should not be a new north-south divide. Perhaps another questions about that I will address to Peter Sands and then to Priya Bashi, if they agree, is which kind of synergies can be fostered between scientists, international institutions, which you represent, and policymakers who are listening to you more than to the scientists to improve prevention, preparedness, response, and especially when it comes to health threats linked to climate change. So, Peter.
Thanks very much, and thank you for the opportunity to take part in what I think is a very timely session and discussion. For all the shortcomings of the global response to COVID-19, what we actually saw was an unprecedented degree of collaboration between scientists, policymakers, international institutions. That's kind of receded a bit as the immediate threat has been seen to diminish, which I think is particularly unfortunate because, as you mentioned, climate change is looming large as the impact of climate change on health is looming large as a massive and very complex challenge. And indeed, I think the collaborative requirement, the bar we've got to hit, is much higher with climate change impact on health than it was with COVID-19. At least with COVID-19, we knew what the target was. The enemy was SARS-CoV-2. With climate change, the enemy is kind of a really, really complex set of interactions. And what we are observing is that both in the scientific world, there are silos, whether it's animal health or agriculture or human health, or indeed the climate community. And in the delivery world, the international institutions, there's the same silos. And likewise, in governments, you often find these things being dealt with in different places. and I must say I commend what PREZODE is trying to do, because that idea of a global network, I think, is really powerful in this kind of context. And the problem is this is coming at us, I think, rather faster than many. Certainly in the global health world, we were kind of focused on COVID-19, and we perhaps weren't seeing how quickly the climate change impact was coming at us. And if I give it just a very small example, I was in northern Nigeria recently, and I saw a shocking number of very, very sick children. And they were sick for two reasons. They were sick because they were malnourished, and they were sick because they had malaria. The malnutrition wasn't enough to kill them on its own, and the malaria, if they were well nourished, wouldn't have killed them on its own if they were treated. But the combination of the two. Now, when I look at the analysis, though, we've got analysis going on about what climate change is doing to malaria, and we've got analysis going on about what climate change is doing to nutrition, and we also have agencies like us, where 2/3 of external funding for malaria focused on the malaria risk. And that, I think, sort of encapsulates, if we're going to have a successful response to these threats, we've got to tear down these barriers and say, we need the science that tells us the combined impact of these things that are happening, and we need the flexibility in the way we deliver support that allows us to address the problem as a whole. We are acutely conscious of this. We are, as the Global Fund, the largest provider of grants to low and middle income countries for health system strengthening. We're also one of the biggest procurers of medical commodities for low and middle income countries. We know we have to be working in partnership, whether it's Gavi or the Pandemic Fund or UNITAID or WHO. We also have a real sense of urgency of this. Our perception is that we're in the global health community, we're a bit behind the game on how fast climate change is changing the dynamics. We're going to see both the epidemiology of existing diseases changing, and that's already evident with vector-borne diseases, and we're also going to see the emergence of new threats in ways that we don't fully understand. And I can tell you, as somebody who isn't a scientist or a clinician, I got lots of questions we need answers to about how all this is going to work. Finally, I just want to pick on Aloise's point. If I reflect on things that went well and badly with the COVID-19 response, one of the traps that many national responses fell into was to be very top-down and to impose things on communities. And surprise, surprise, and use the word of trust. Surprise, surprise, quite a lot of communities pushed back and didn't want to do the things that their governments were telling them to do. Our history of 20 years of fighting the biggest infectious diseases has taught us that if you don't have communities and civil society completely on board, you're not going to be effective. And that's true because of trust, but it's true because particularly if you're reaching out to those who are most disadvantaged, those who are most marginalized, governmental and conventional systems often don't work very well in achieving that objective. And it's really important when we talk about this, though, that it's not just a kind of token involve communities and civil society on the margin. They have to be involved in the decision making. They have to be involved in the design. They have to be involved in the delivery. And certainly when I think about where we are on pandemic preparedness, I don't think we're quite in the place that we will need to be if we want to be truly effective on that dimension of the response. As I say, thank you very much for inviting me to engage on this. I think it's a really important topic, and I think particularly with the complexity of what climate change is doing to agriculture, animal health, and human health, we need more than ever this synergy, collaboration between scientists and policymakers and institutions, and all of us being prepared to kind of go beyond our boundaries in exploring and responding to these challenges. Thank you.
Thank you very much. Priya, you're heading this brand new pandemic fund, so you also tackle all these challenges, and it's global, it's embedded in the World Bank. So can you give us your view on it? Thank you.
Sure. Well, thank you very much for inviting me. It's an honor to join this roundtable. I think just building on the points that Peter put forward very eloquently. I think there are silos everywhere, and I think it's very important for us to break those silos and to get science and international organizations and policymakers and communities and civil society to collaborate and work together in finding and implementing solutions to creating resilience to future pandemic threats. And as the point that Peter was making, I mean, climate change really is increasing vastly the risks of new outbreaks. I was reading a study just the other day. I think it was brought out by some kind of a scientific research organization that said that there's a 60% chance of another COVID-like pandemic in the next 25 years. Think about it. I mean, that's and that risk is exacerbated by climate change, by changing land use patterns, by changing patterns of water consumption, deforestation. So anyway, we live in this world of multiple risks, and those risks are playing into new disease threats and threats that can transmit themselves from animals to humans. And so now the Pandemic Fund. We at the Pandemic Fund very much recognize the importance of listening to science. We have science at every step along the way. There's the question of incorporating science into the design of projects, and the projects that we ask for. You often get what you ask for. So when when we ask for projects to be prepared, we're asking countries to work together with their international partners and regional partners to prepare solutions to pandemic threats that really do build in scientific evidence. Then, when it comes to evaluating those projects for their strengths, we have a technical advisory panel, and in fact, we have a couple of members of that technical advisory panel around this table. Osman is part of our technical advisory panel. Marissa, I don't know where she is now, but she was here. There she is. Yeah, is also part of our technical advisory panel. So we have scientists, we have social scientists, we have natural scientists, we have economists, we have development practitioners who sit around and assess and analyze every project that gets submitted. So we're recognizing the value of multidisciplinary voices in this evaluation process. And then there's also the importance of science in implementing and collaboration between social scientists and natural scientists and practitioners and civil society and communities in the implementation of these projects, because we're not going to have success unless we can break those silos at the implementation level. So then maybe just a point about One Health, since it's been brought up. I think One Health means many things to many people, but it's important to emphasize the importance of One Health at the prevention stage, at the preparedness stage, and the response stage. And there's very different things that are needed, in terms of collaboration between science and policy making, and between agriculture, environment, animal husbandry, and sort of human health at each of these stages. At the prevention level, which really can arguably be the most impactful level. Because, I mean, once a pathogen gets transmitted from an animal into a human, then it's really hard to contain. But if you can prevent it, you know, at source, then that is a smart thing to do. And that really does take science, you know, scientists to work together with those who are kind of involved at the policy-making level, but also it requires vets and doctors to talk together. I mean, we have some projects that we're funding. In fact, 80% of our projects being funded under the first round of the pandemic fund are focusing on One Health, and many of them are focusing on prevention. And, you know, they're looking at things like having doctors and vets go out together into wildlife parks to be able to, you know, do that early detection. They're looking at, you know, building all kinds of sort of interesting but not that complicated wastewater surveillance systems at points of entry. So, you know, that's at the prevention stage. But at the preparedness stage, again, you need, you know, during peacetime, if you want to invest in preparedness, and you want to do it smartly, then you have to have your departments of health and government work jointly with your departments of agriculture, your departments of animal husbandry, your departments of environment. So, you know, many of our projects are sort of doing that, trying to achieve sort of that multi-sectoral view around preparedness. And then, of course, response. We all have learned from COVID how important it is for policymakers to listen to scientists and to have that trust in science. So, you know, again, a very important topic, and sometimes it seems obvious, you know, how can you really effectively deal with a health threat if you're not listening to science? And, you know, sometimes, you know, kind of as I was looking at the topic of this discussion, I was thinking, you know, as the Americans say, it's a no-brainer, right? You really ought to be listening to science, and yet we're sitting here and we're emphasizing the need. So thank you for highlighting this agenda, and thanks again for giving me the opportunity to share my thoughts.
Thank you very much, Priya, for this extensive view on what you're trying to do at the end of the pandemic fund and your remarks. And from what Peter said and what you said, what is very important is this question of silos and of course the question of climate change, which adds a level of uncertainty both for scientists and decision makers, is very important, and is one point to break more silos than even what we were trying to do before. On this issue, you've been both touching on science, society, policy. I will ask Anne-Claire Amprou de nous donner un peu sa vision sur ces éléments. Merci.
Thank you very much. I'm very pleased to see you here in Paris for the Paris Peace Forum. Many people. Actually, this question about the dialogue between science, policy, society is key. I just come from Geneva, where there is an ongoing negotiation of the pandemic agreement. That's why I was late, very sorry. And actually, this week, we spent hours and hours to speak about prevention and the One Health approach. The pandemic agreement is to address the three pillars: prevention, preparedness, and response. For the first one, of course, the One Health approach is key. But actually, as it was mentioned, it's like a north and south dividing issue, and it shouldn't be like that. And this week, it was again the case, and this dialogue is not obvious. And as you mentioned, to have the stakeholders around the table, it's just necessary. Otherwise, we cannot improve for the prevention aspect. France launched last month the new strategy for global health for the period 2023 and 2027. And the One Health approach is one of the guiding principles, and we wanted to focus on it. But building a science-society policy dialogue, taking into account this specificity of the One Health approach is necessary, but it's not obvious, and it's not easy, actually. It's necessary. I think that we do agree, but how to build it, it's another issue, and especially when I look back to the discussion we had in Geneva this week, that's very, very relevant. So it's an ongoing process which requires sustainable efforts, collaboration, adaptability to address this dynamic nature of pandemics and public health challenges, such as climate change, as it was mentioned by Peter. So how to build this dialogue? At least 4 points. I'm sure I will forget many, but at least 4 points. The first one is we need an established, strengthened, multi-sectoral and inclusive group of stakeholders, including policymakers, experts, society, and experts from various backgrounds and various scientific disciplines. Human health, of course, but also animal health and environmental fields. And this is this multidisciplinary approach which could help, definitely. And again, we talk about experts this week in Geneva. The question was, who should be the expert? How will we choose the experts? Of course, we didn't agree on that. Well, but we knew we need to have this dialogue, and we need to create these relationships. And so that means that we need some events. And the One Sustainable Health Forum, which took place in July in Lyon, was a very good example of what we should have regularly. This meeting is a very good one also, and we need this kind of event to create this dialogue. So that's the first point. The second one, I mentioned civil society, policymakers, stakeholders, experts, but we need to involve also communities, because they are key, and we need to involve exposed communities, especially affected by pandemics, because they have an added value in the speech and to explain on how to make the link between what they have, what they suffered from, and what should be done. The third point, of course, is about the policymakers. When they have to make very strong decisions about pandemic, or when they have to negotiate in a room with 194 member states at WHO. And we need to have these policymakers involved in the discussion with evidence-based recommendations. And of course, this dialogue between scientists and policymakers needs to be very strict, especially because they need to keep their own responsibility. Scientists will not make a decision, and policymakers will not give an explanation or a scientific explanation. They need to keep their own responsibility. We know that during the COVID-19 crisis, we had this debate. But this dialogue is very useful, especially to have the translation of the outcomes of the dialogue into concrete action. And again, that was what member states, especially from the South, requested this week. When we talk about the One Health approach in a pandemic agreement, concretely, what does that mean for them on a very daily basis policy? And of course, especially when we talk about surveillance and the added value of the One Health approach for surveillance. The last point is about information and misinformation. We know that when we talk about pandemics, the risk of misinformation is very high. So we need tools to inform, to communicate, and that's key for this dialogue and globally for the population. So when we speak about the One Health approach, we need to promote it on a daily basis, especially through this dialogue between science, society, and policymakers, and at all levels, with a multidisciplinary approach. And that's why France strongly supports the PREZODE initiative, because it's exactly the approach which was chosen and which is very, very useful. And we need concrete example to show to everybody, to policymakers, the added value of this approach. Thank you.
Thank you very much, Anne-Claire. And I strongly support many of your points, and especially the question of information and access and transparency, which are really key. And also one point you mentioned about the science policy and the way they interact, and the difference of culture, the difference of time frame between the policymakers and the scientists, and each one has to know very well the rule of the game of each community, and this is very important. And of course, policymakers are getting more used to know how scientists work, the community, the knowledge, the fact that they really, before they give information, it has to be double-checked, and the peer systems. But sometimes the scientists I know well, they do not know at all how policymakers are working and which are their needs. And sometimes it's very complicated for them to make a policy brief, just saying things, these are the risks, this is the possibilities, these are the options. And there is also, we talk about the scientific culture of our decision makers, but we should also talk about the global policy culture of our scientists, which is another way. I will give the floor to Marie-Ange and to Agnès to give us their view on the next challenges for global health actors and how the science can tackle those challenges. So we will start with you, Marie-Ange.
Yes, thank you, and really so nice to see so many colleagues and friends around the table. It means that we are starting to talk more regularly. I think I will start maybe by saying, and maybe coming to the first question, because it links to the challenge that I think Osman talked a lot about the different science. And I have to say, for us, a lot of us in the global health actors, actually what science brings is solutions. And I think in the COVID-19 pandemic, I think, if we look at the lessons probably 100 years ago, in the next 100 years, we will say that actually science delivered. They brought us, for example, a vaccine in 9 months. And that's undeniable. It's probably the only thing that will be undeniable. Because then, we have to take it from what was delivered from science. And then, actually, the big challenge is the access. And I think a lot of you have mentioned it here, and I think it has come from many interlocutors here. So I think let me now delve indeed into what the challenge means then going forward. And I think one of the first challenge, of course, is rebuilding, restoring, accelerating to, in a sense, go back to, or even better, to, having systems that really can help, withstand any of the future challenges. And what this means, and I think what we have to acknowledge, and I think Papa Sek said it very well, is that actually countries made a lot of efforts. A country like Senegal, and we know it at Gavi for working with them, they administered 3 times more vaccine in a year than any given year. And what it means is that the investment that a lot of people are making in this room work. But we have to do it at a different intensity so that we are able to tackle some of the challenges that you have talked about. So I think it's really, accelerating and rebuilding these systems, very important, and it can be routine immunization for Gavi, it can be different things for various actors, because that will be actually the backbone to continue accelerating, and that's the link to the preparedness, of course, and it works, so I think that we see that. What it means also is actually accelerating the tools that we have that already can help the threat that we see. We talk about climate change. we already have actually, and we are lucky, a portfolio of vaccines that tackle some of the diseases that are very prone to climate change, you know? And so we need to be ready to really roll it out much better. And of course, you know, Peter talked about malaria. It's also about looking at how we now have a vaccine after 35 years, you know, how, and of course the improvement, how it's paired with other interventions. But I think we have to be mindful also that there are things that exist. It's not like we have to you know, like for the COVID-19, do some of the other interventions. So that's very important, the rebuilding. What's also very important is being able to have this surge capacity that, in a sense, we didn't quite have at the beginning of the pandemic, so that it allows us, because a lot of these challenges, actually, it's about the intensity of the response because of the shock. You know, a lot of time, but at least, of course, we know what we know, we don't know what we don't know. But actually being able to go 60%, you know, and being able to have more of be able to prepare better and think about this intensity is very important, because that's where the surge comes, and having the tools to do that. But I think the point I want to emphasize more, and it has been hinted here, but I really want to pressure test when it comes to the access, is the regionalization. Actually, what the crisis showed us is that we were really, you know, relying on a global system that works very well when markets are open, but then when they are not quite open. And I think Papa and others have mentioned it, the regionalization. And I think that's where we have to think differently. So how we work differently, the regionalization, the different partnerships, Peter said it, and others, and partnership not just in our own little pond, but indeed with different actors, and this type of forum I think is very important, and there needs to be a systematic way, but also other ways in organization to look at that. But when I think about regionalization, one of the big issues, and Eloise alluded to it, is that, you know, being able to have the scientific solution delivered from various points. And that's where a region makes sense, because often you have a question of critical mass of either of science, of capacity, of production, and that's what has been so acute. So of course for us, you know, as you are familiar in Gavi, we are really working with the African Union to really push the African regional manufacturing, and are developing an instrument for this. But it's really true for a lot of things, for science, for the regulatory aspect, and maybe that's some of the way we have to look at more systematically, in a sense, to bridge the gap, as you were mentioning, Anne-Claire, in how we bring different communities together, because they cannot necessarily be in every single country. Of course, that's what we want ultimately. So I think that aspect is really key. And that's one of the things that we have to look for. But I think also one of the key points is that there are several aspects in science. Often, and you said it, scientific experts, they want to triple check the results, but I think there's also a value, and to help this dialogue with the scientists and the policymakers and the actors, is to have kind of these radar functions. You know, for example, us at Gavi, we do every 5-year vaccine investment strategy that look at 10 years, what vaccine do we hear may be coming? And from the various, you know, because there are diseases out there. And it's important because it helps thinking about the investment, of course, in 10 years, but eventually the next time we go around is much closer, and you can think about the investment, and that's how you think about also you translate it in these national strategies. So I think that's what I would say, and over to Agnès.
I will really try to speak from the finance and investment perspective, and maybe to that matter make 3 short points in favor of science in what we're doing, and maybe two recommendations which we think are really critical if we want to move forward. On the importance of science, I think the COVID-19 crisis definitively has shown how critical this is. But we also need to think that we need to include all aspects of science, not only biological science, not only hard science, but social science. And this has been said about the question of trust in the system, but it's much broader than that. It's about understanding behaviors. It's about understanding household economics and behavioral economics, and we need to invest much more on that. And in Agence Française de Développement, in our program that supports One Health projects, we make sure to systematically match social science investments in surveillance as well as operational research with the more hard science investment. So it was very clear, of course, when we invested in genomics, for example, during COVID-19, that we linked it to activities to understand, to better grasp the obstacles to vaccination in real life setting. And as you know, it turned out that was a central issue. The second point, I think, has been mentioned by Priya, but it's really what we see as science is key if to identify, prevent, and treat early. So this whole point, also made by Anne-Claire, about prevention and promotion, this is all about science because this is what is under the radar. This is what we don't see, and that's why we need to invest in having less of the what we don't know, we don't know. So knowing a little bit more is certainly what we need to do, and there the investments in population-based studies, so for example, surveillance of pathogens in sewage or fresh water, integrated surveillance that include environmental surveillance is absolutely central. And we're really currently supporting PREZODE in this matter. We support different regional surveillance networks, both in Southeast Asia, in the Indian Ocean, in the Caribbean. And they are all geared towards that collaborative and integrative surveillance that brings on board the environmental surveillance through a One Health approach. And for us, that's really absolutely central if we want to have the benefits of science feeding into actual programs and actual public policy. The last point is on the importance of science for investments and finance is really the prioritization and the importance of including science, including cost effectiveness and budget impact analysis, economic science, to understand better what the trade-offs are when you have limited envelopes for investments. What mix of interventions in a One Health approach is best when you have a limited amounts of funding. So if we look at AMR, for example, how do we support the right mix between information of the general public, training of prescribers, improving the accuracy of diagnostic, fighting against substandard falsified medicine, or developing new treatments? We need more science to understand this kind of trade-offs. So to conclude, I'm thinking come with two recommendations. I think the first one, and it's been already taken home quite a bit by development banks, is the point of impact evaluation. If we want to know what our money is doing, we need to invest early when we fund projects or programs and nest in impact evaluation. This has been taken on by the World Bank with the DIME program. In AFD, we have the the Innovation Fund, Development Innovation Fund, that is chaired by Esther Duflo. And we are actually increasing the funding for this fund because we see that we need to know more about what works and doesn't work when we invest, including when we invest in One Health of programs. So impact evaluation is not a luxury. It has to be built in our investment. And my last point, which is in a way probably the most important point, is that if we want to maximize the benefits of science-based policies, we need to make sure we have the right governance. And we need to make sure we address the interactions between science and politics, including the conflicts of interest between science and politics. The COVID pandemic has really shown that political control and interference of politics in the production of science is not a good thing. And this has happened across the political spectrum, right? We know what happened in the US, what happened in China, what happened everywhere in that relation between politics and science. So I think what the lessons learned there is whether it is at country level or at global level, for example, in the WHO, it is fundamental to have a very clear separation of function with a governance of science that is adapted and includes all the necessary transparency and being able to hear all different voices in an independent and autonomous way, and delink that governance of science from the political governance and the decision governance. And for that, I will really call, as many of us on this table are calling, for establishing One Health scientific committees in every country that really bring the scientists to provide independent and autonomous scientific guidance to governments, but also to bring this kind of scientific evidence into the policy dialogue through appropriate mechanism. And for that, when I was at WHO, we developed what we call the 3D approach: data, dialogue, decisions. And it's really about building three spaces: a space of science, totally independent and autonomous with an appropriate governance; a space of dialogue, which is about talking to the general public and having that conversation that is building trust; and a third base of political decision. And that these are really handled in separate spaces with firewalls, but also handled in a way to build bridges in which the science that is produced is brought into the political debate and is informing the political decisions. We need both firewalls to avoid conflict of interest and transparent processes to document the dialogue. Thank you.
Thank you very much, Agnes. It's time for concluding remark because we've run over time. So thank you very much for all the participants, and thank you for everything that you've transmitted, all the information, your commitments. It's quite complicated to do wrap-up because it was very rich. So I would just make four concluding remarks, a very short one. First, what I retain from this exchange is that One Health is more relevant than ever after the COVID crisis, and also because we've seen that climate change, loss of biodiversity are new risks, and that they interfere with this question of health. My second point is that we should acknowledge that some progress has been made in international organizations, but also in countries which have become more organized. My third point would be that science was the incentive to talk about One Health when we had the COVID crisis, but science is also part of the solution. And more than part of the solution, science needs to really to be an asset in each country, so to be developed at the global level, by way of committee, just like Agnes pointed, but also to enhance local capacities, and this is really ahead of us. And fourthly, that for this, we really have to develop more the dialogue we have between policymakers and science also. Breaking silo, this has been a motto around the table, intensifying dialogue, and also accountability. Say what we do, the way we do it, sharing information with the communities and sharing broadly the information and decision. So at the end, we really need to go on working together in working groups by ways also of call for action. And I think this is very important to keep pressure on this subject. And so I hope we can convene another time and and that we will be able to acknowledge the progress we have made. So thank you very much for your participation and your attention.